today we're going to talk about giving either an eye drop or an eye ointment to your pet. So when you're doing eye drops and eye ointments, sometimes what's going to happen is your pet will actually be sent home with 2 of these medications. And the one thing that you always want to be aware of is you always want to do a solution like an eye drop first and then do an eye ointment. Because if you do it the other way around, the eye ointment is a thicker ointment, so therefore if you put a drop on it, the ointment is actually going to beat it away, so your pet is not going to get any benefit from that eye drop, okay? Also, when you're doing eye medications, you want to allow about 5 to 10 minutes between each eye drop so that, again, your pet is getting a benefit of that medication. If you're putting one medication in and then you're following it with another one, it just kind of washes it out, so your pet isn't going to get what it needs from that, okay? So when we're going to start with drops, so with the eye drop, what you want to do is you're going to have your pet and you want their nose to be facing the ceiling. And a lot of people do struggle with this. If they've got cats or small dogs that are a little wiggly, what you can do is actually kind of grab a towel and just wrap their feet, wrap them up like a burrito so you have a little bit more control. You're going to have your hand under, you're going to have them, again, their nose facing the ceiling. And then what you're going to do is you're going to put a drop on that eye, okay? Now when you do an ointment, this is a little bit of a challenge because you don't have control over how much of the ointment comes out. So what you want to do is, a lot of people have concerns because you do have a metal tip, and then if you've got a really wiggly pet, there is a chance that you can actually poke your pet in the eye. So what you want to do is squeeze out a little bit of the ointment. Again, have them facing up, and you want that ointment just to touch the eye. You want to close the eye, and so that the ointment will melt over it. So you're never really putting the tip on the eye at all. And like I said, these can be a little bit of a challenge because you don't have a control over the volume that you give. So just a little light pressure, that's all you're really going to need to get this ointment to come out. As the tube starts to empty, pretty much think of it like a toothpaste tube and roll it, and that will actually allow you to squeeze out the ointment a little bit easier. And that is how we're going to do eye drops and eye ointment. So if you have a puppy, patience is actually key. You just got to give them the time and just allow them to kind of work out their excitement and all of that. Also, if a patient is really painful, they're not going to really want you doing anything near their eye. Again, this is where patience comes in. So what you can do specifically with drops, you can't really do this with ointment, but if you've got a drop, what you can do is when you have them their nose facing up towards the ceiling, instead of coming in really close, you can actually come in at a little bit of a distance, so you're not directly in their face, and you can drop, apply that drop from a distance into their eye. And that will probably get them a little bit more comfortable working around their face. Once the medication starts to kick in and starts working and they start getting more comfortable with their eye, you can come closer. But if you're finding that you're not able to do that, try the distance and see if that works.